Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. If you're sneezing through spring, breaking out randomly, or wondering what's triggering your reactions, you're not alone. And here's the good news: you don't need to spend hours in a doctor's office to find answers anymore. According to Mayo Clinic, over 50 million Americans experience allergies each year, yet many never get tested because they assume it's expensive or requires a clinic visit. In this video, we're breaking down exactly what allergy tests cost, how they work, and which online options are actually legit. Whether you're looking at skin tests, blood tests, or at-home kits, we'll walk you through the real numbers and what to expect. The NIH notes that knowing what you're allergic to isn't just about comfort. It's about managing your health long-term. Undiagnosed or mismanaged allergies can lead to chronic sinus issues, sleep disruption, and even asthma complications. Testing helps you identify specific triggers so you can avoid them or take targeted action. Whether it's pollen, pet dander, dust mites, foods, or environmental allergens, a proper test pins down exactly what's affecting you. That knowledge is worth the investment because you can then make real changes, switch air filters, modify your diet, or talk to a clinician about treatment options that fit your specific triggers. Without a diagnosis, you're basically guessing. According to MedlinePlus, there are 3 main ways to test for allergies: skin prick tests, intradermal tests, and blood tests. Skin prick tests are the fastest and cheapest. A clinician makes tiny scratches on your forearm and applies allergen samples to see if you react. Intradermal tests go deeper and are more sensitive, typically used when skin prick results are inconclusive. Blood tests, also called immunoassay or radioallergosorbent tests, RAST, measure allergen-specific IgE antibodies in your blood. No needles on your skin, so they're great if you have sensitive skin or take certain medications. Each method has trade-offs. Skin tests are quick and cheap but require an office visit, while blood tests can be done remotely but take a few days for results. Here's the pricing reality. A skin prick test at a traditional clinic typically runs between $200 and $400 out of pocket, or about $60 to $200 if insurance covers it. Blood allergy tests are pricier, $300 to $800 uninsured, though insurance often picks up $150 to $400 of that. At-home allergy kits, which are blood-based and send samples to a lab, range from $100 to $400 depending on the company and how many allergens you're testing. The Mayo Clinic notes that costs vary wildly by region and provider, so getting quotes up front is smart. Without insurance, expect to pay $150 to $500 for a comprehensive panel. With insurance, you're typically looking at a copay between $25 and $150, assuming allergy testing is covered. So check your plan first. Let's walk through the most common type, a skin prick test. You arrive, the clinician preps your forearm with an alcohol swab, then applies a tiny drop of allergen extract, usually 15 to 50 different allergens, and makes a shallow prick under each drop. You wait 15 to 20 minutes. If you're allergic, you'll see a small raised bump and redness at that spot, like a tiny hive. The size of the bump indicates your sensitivity level. Blood tests work differently. You or a phlebotomist draws a sample, it's sent to a lab, and within a few days to a week, you get a report showing your IgE antibody levels for specific allergens. Both methods are reliable. The Cleveland Clinic notes they're accurate about 85% of the time when combined with your symptom history. Neither is invasive or dangerous, though you might have minor itching during a skin test. Here's the trade-off. Clinical tests give you immediate results and a clinician's interpretation, but they require a visit and cost more upfront. At-home kits let you avoid the office, but you're drawing blood yourself and sending it off. So there's a delay and no real-time guidance. MedlinePlus says both approaches are medically valid as long as they're lab certified. The real question is what fits your life. If you want answers fast and don't mind a clinic visit, go professional. If you prefer convenience and already know roughly what triggers you, an at-home kit works fine. That said, at-home kits are best for confirming suspected allergies, not for comprehensive testing when you have no idea what's causing symptoms. And importantly, a positive result from either method should be discussed with a healthcare provider before making major lifestyle changes. Several companies now offer online allergy testing. Services like Everlywell, Let's Get Checked, and similar platforms let you order a kit online, get it shipped to your home, collect a blood sample, and mail it back for lab analysis. The process is straightforward. No middleman doctor visit needed. Costs typically fall between $150 and $300 all in, and results arrive via app within 5 to 10 business days. Some telehealth services bundle this. You order online, do the test at home or at a partner clinic, and then have a virtual consultation to review results. The catch: you're still not getting real-time skin testing, so if you need intradermal testing or a comprehensive professional workup, you'll need to visit a clinic. Always verify the lab doing the testing is certified by CLIA, the FDA's clinical laboratory standards body, before ordering. Insurance coverage for allergy testing varies by plan. Mayo Clinic notes that most plans cover skin and blood allergy tests if they're medically necessary, meaning you have documented symptoms and a referral from your doctor. If you're uninsured or your plan doesn't cover it, some clinics offer payment plans spreading the cost over a few months at zero interest. FSA and HSA accounts also cover allergy testing, so use those first if you have them. It's a smart, tax-free move. Some online services offer discounts if you pay upfront or bundle multiple tests. The bottom line: don't assume you'll pay full price. Call ahead, ask about self-pay discounts, and check if your insurance covers it before scheduling. Many clinics will waive or reduce the cost if you ask. When results come back, you'll see a list of allergens marked as negative, low sensitivity, moderate, or high. That's educational information, not a diagnosis. The CDC emphasizes that test results should be interpreted alongside your actual symptoms. A positive result for something you've never reacted to might be a false positive or a future sensitivity. Share your results with a clinician who can help you understand what they mean for your daily life and what steps make sense. Avoiding triggers, considering immunotherapy, using medications, or simply monitoring for patterns. Online results are most useful when you already suspect certain triggers. If your test comes back with 10 high sensitivities and you're confused about what to do next, that's when you'd want a professional consultation to make a real action plan. Don't let a positive result panic you. Work with a healthcare provider to decide what's actually worth changing. So here's what you've learned. Allergy tests cost between $150 and $400 depending on the type. And your insurance? They're available both online and at clinics, and each option has real trade-offs on speed and convenience. Whether you choose a professional skin test or an at-home blood kit, make sure the lab is certified and you understand your results before making major changes. The research from Mayo Clinic, the NIH, and the Cleveland Clinic is clear. Knowing what you're allergic to beats guessing every single time. If you're ready to get tested, start by checking your insurance, getting a quote, and deciding if online or clinical works for your schedule. Then follow up with a healthcare provider to make sense of the results and build a real plan. Click the link in the description to find certified testing options near you and read the full cost breakdown.